A new parent, after the birth of their baby, is faced with a lot, and one of the essentials is vaccination. Could you please help share some of the most important vaccines that they must know about for the first 3 months of the baby?
Okay, when a baby is born, as soon as possible, baby is administered three important vaccines. One is zero dose oral polio that would protect the child against polio. Then you have hepatitis B to prevent hepatitis B. And then you have BCG that protects the child against tuberculosis. The second set of vaccines comes at the age of 6 weeks, which consists of one is second dose of hepatitis B, a combination vaccine of diphtheria, tetanus, and pertussis, that is whooping cough, oral polio or injectable polio, whichever is available. And then you also have certain new diseases against which vaccine is being offered, both in public health as well as in private sector. Like say Hib is a bacterium which causes meningitis, pneumonia, and bloodstream infection. So you have a vaccine against Haemophilus B influenza bacterium. So that is called Hib vaccine, which is available either as a standalone vaccine or in combination with your diphtheria, tetanus, pertussis vaccine. And finally, you have certain new vaccines introduced in some parts of the country in the form of rotavirus vaccine, which is given orally to prevent diarrhea caused by rotavirus, and pneumococcal vaccine, which is used to prevent pneumonia, meningitis, and bloodstream infection. Like your Hib bacterium, there is a bacterium called pneumococcus, which leads to these infections. So these two are new entrants on the immunization schedule in the national program as well, but not uniformly available across the country as of now. But yes, in private sector, all these vaccines are available and they are licensed, and almost all the doctors are using them.
Okay. And you mentioned the dosage of DPT at 6 weeks. Is that it? Or
Yeah,
there are
a
any
baby
other
is
doses?
given 3 doses of DPT at 6 weeks, 10 weeks, and 14 weeks, followed by a booster at somewhere between 18 to 24 months, and a second booster at the age of 4.5 to 5 years.
Okay, that's helpful to know. There's a lot of conversation on Baby Chakra regarding the types of DPT vaccines and the nuances around it. Can you throw some light around
Well,
it?
DPT, as I said before, is combination of vaccine which prevents diphtheria, pertussis, and tetanus. Pertussis is a whooping cough. The vaccine which is in use for last several years and which is still being used in the national program in public health is made from the whole bacterium of whooping cough, that is pertussis, which is known as diphtheria, tetanus, wholesale pertussis vaccine.
Okay.
Now this vaccine it leads to a lot of reactions in terms of pain at the site of injection, swelling, redness, and excessive crying because of this local side effects. Now this vaccine was the first vaccine to be introduced against pertussis or whooping cough. Over a period of time, the disease came under control and these side effects started becoming unacceptable to public. So a refined vaccine was invented, and that is being used in almost all the developed countries, which is known as diphtheria, tetanus, and acellular pertussis DPT vaccine.
Okay. And both these variants are available in India.
Yes, both these variants are available, though public health program uses the wholesale pertussis vaccine, the acellular pertussis vaccine, which is less painful, which does not give rise to such severe adverse reactions following injection at the local site, is very much licensed and available in India for use in private sector.
Okay. And other than the severity of the reactionary symptoms that you mentioned, are there any significant differences between the two variants?
Oh
that
no,
parents-
by and large, both are in terms of what we call as efficacy, both are almost equivalent.
Okay. That's a good point you arrived at, doctor. In fact, most people tend to believe that the degree of pain and reactions post vaccination determines the efficacy, and it is good if the baby has pains. That's what many parents are given to believe.
That's
Can
a
you share
that's a
that
common myth amongst most of the public. But say if you look at other antigens like hepatitis B, hepatitis B is a vaccine which is given at birth, and then 2 more doses are given at fixed interval. This vaccine never gives rise to pain or fever or swelling at the site of it. Does that mean that this vaccine is ineffective? No. So this is inherent property of the wholesale pertussis component of the DPT vaccine to cause reaction in terms of pain, induration, and swelling. That is not so commonly seen with other vaccines. So it's a myth that if the child gets fever or swelling or has reaction, that means the vaccine has been taken up well by the body's immune system and it is more effective as compared to other vaccine. No, that's not the case. The acellular pertussis vaccine, as I said before, is much less reactogenic and you hardly have any pain or redness or swelling at the site of injection. But this is the vaccine which is in use in almost each and every developed countries. And they have successfully controlled this disease with this new generation acellular pertussis triple vaccine.
Thanks for debunking that myth, doctor. So, in case of either of these vaccines, in case the baby faces any post-reactionary symptoms, as each baby is differently mentioned, what are some of the tips you advise parents to give the baby some instant relief?
Like as I said, whether you use the wholesale DPT or the acellular pertussis containing DPT, there are a few extremely rare reactions which babies can get. They need to contact the doctor as soon as possible. Like some babies cry inconsolably after a DPT vaccine. Some babies throw a fit. But then I don't want to scare people unnecessarily, naming these very, very rare side effects.
Okay.
So these are extremely uncommon, extremely rare. And in case a baby has any of these reactions or baby becomes just limp and loose, they need to rush to the nearby doctor. Sometimes babies develop severe anaphylaxis reaction and where the baby, it can be life threatening. But again, these are seen extremely rarely and that could occur with any of the vaccines, not necessarily the triple vaccine.
Okay. That was a very good roundup about the DPT vaccines, and thank you very much for sharing all this information with the community at Baby Chakra. Thank you.
Thank you.